Good day everyone, my name is Carol Jane B. de Guzman and today I'm going to be tackling about the pharmacodynamics and pharmacokinetics of a certain drug class. Now the drug class that I've chosen for this case scenario study are the bronchodilators. So bronchodilators are medications that relax bronchial smooth muscle to open airways, increase airflow, and aid mucus clearance, primarily treating asthma and COPD. Now COPD is a collective term used for chronic obstructive pulmonary diseases, which are diseases that causes problems in airways, thus creating breathing problems for our patients. Now the medication that I will be solely focusing on for this video is the salbutamol, or also known as the Albuterol. It is a rapid-acting bronchodilator used to treat asthma, COPD, and wheezing by relaxing airway muscles. It is commonly used as a reliever inhaler. Example, Ventolin. It is a short-acting beta-2 agonist. Side effects often include tremors, or also known as the shaking of the hands, headaches, and rapid heart rate. Now, what are the key details about salbutamol? It is primarily, again, used to treat and prevent bronchospasm in patients with reversible obstructive airway diseases such as asthma and chronic bronchitis. So there are actually three forms of salbutamol, or three dosage forms of salbutamol. The first one is we have the inhaler, or also known as the metered dose inhaler, which is the most commonly used dosage forms because it causes rapid relief for our patients with breathing difficulties. The second one is the liquid salbutamol, which is used with a nebulizer in order for it to reach the airways. The third one, the last one, are the oral forms, which are either syrups or tablets. For our case study, we have Maria, who is 24 years old, a female, who has a diagnosis of acute asthma exacerbation, and her relevant medical history is that she is 24 weeks pregnant. Now that we know the brief description of what salbutamol is, let us go further into details with understanding what this drug is really all about through its pharmacokinetics. Now, pharmacokinetics explains what the body does to the drug, thus it also explains the term of ADME-flow. ADME-flow is an acronym that explains the absorption, distribution, metabolism, and excretion of the body and how it reacts to the drug. Now, for the first one, let us go explain the absorption bit. Now, imagine when Maria inhales, actually only 10% to 20% of that drug actually reaches her lower airways because the rest of the 80% gets swallowed. It gets stuck at the back of your throat. Because salbutamol undergoes significant first-pass metabolism in the liver, the swallowed portion has very low bioavailability, so it actually doesn't get circulated in your system. The next one is the distribution part. The drug is distributed locally to the bronchial smooth muscle. It has low protein binding. Roughly only 10% of the drug gets bounded to proteins and is inactive. Fortunately, the remaining 90% of the drug remains free and active to do its job, like those pharmacological effects that the patients need to relieve their symptoms. The third one, which is the metabolism. It explains that the liver eventually processes the drug into an inactive metabolite called the albuterol 4-O sulfate, which is essentially the trash version of the medicine and is now being readied for it to go into excretion. Finally, the kidneys take over. About only 70% of the dose excreted in the urine. Its half-life is relatively short, for about only 4 to 6 hours, which is why Maria may need a repeat dose if her symptoms persist. It explains that after 4 to 6 hours, she can also receive a new dose of salbutamol because of the half-life, which is relatively short. Now that explains the pharmacokinetics part of salbutamol. Now let us move further to the pharmacodynamics part of this topic, which explains what the drug does to the body. Thus, it explains how the drug actually fixes Maria's problem, or our patient's problem. Salbutamol, again, acts as a selective beta-2 adrenergic agonist. Think of beta-2 receptor as a lock, or also called the receptor, located on the smooth muscles of the lungs, or the bronchial smooth muscles. The salbutamol is the key that fits perfectly into that lock. Once bound, it triggers an enzyme called adenyl cyclase, which increases cell levels of cyclic AMP or the CAMP inside the cells. This chemical signals tells the muscles to relax. This results in bronchodilation. It opens Maria's airways so that she can breathe again. However, if Maria uses too much, the drug can overdose, or what we call spillover, and hit the beta-1 receptors in her heart, causing tachycardia or the racing of heart and tremors, which is the shaking of the hands. This is why we monitor the dose-response relationship closely to ensure that Maria is taking her salbutamol with caution and for her safety. In Maria's case, we have two critical clinical considerations. If Maria were taking beta blockers for her blood pressure, they would act as the antagonist, effectively plugging the receptor locks and preventing salbutamol from working because it causes the bronchodilation. This could lead directly to dangerous respiratory failures. For the second one, we have her pregnancy. Because Maria is 28 weeks pregnant, we must ensure that the benefit outweighs the risk. So we need to have her benefits more than the risk that it's going to give. So fortunately, salbutamol is the gold standard because it is also known as the rescue inhaler in pregnancy, because the risk of Maria and her baby losing oxygen during an asthma attack is much higher than any minor side effect from the drug. So meaning to say, it is safe and efficient and is recommended for pregnant women. In conclusion, to wrap it up, salbutamol is a life-saving tool that relies on a rapid local absorption and precise receptor binding to reverse bronchospasms. By understanding its ADME, its absorption, distribution, metabolism, and excretion, and mechanism of action, we can safely manage patients like Maria and ensure they breathe easy. And that is all for the explanation of the salbutamol and how it goes through its pharmacokinetics and pharmacodynamics in order to treat patients like Maria, and especially during her pregnancy. And that is all. Thank you.